Hello, this is Laverne 1977 and doing a video response to Vagina Fun TV1. That video, it was funny, but it was kinda on point. I really feel where you're coming from. Some people are just generally lazy and have bad body odor, and not just women. But since I work in the midst of funky vaginas, I do know that not all funky vaginas are funky because they're not clean. Some women have issues and they may not realize they're having these issues because they're trying to do things to mask odor when there's actually something underlying that's causing that odor. One thing that we see a lot where I work for an OBGYN. So yeah, I'm dead on in the middle of the funky vaginas. BV is a big cause of vaginal odor sometimes. Also, trichomonas, which is an STD. It's a parasite that can cause you to have a funky odor. Yeast infections, if it's severe enough, can cause you to have bad odor. And a urinary tract infection can cause you to have a bad odor. With BV, I know in that video, Martin's little joke he was cracking, he'll tell a woman to douche. Well, the woman's doctor is going to tell her not to douche, because actually douching can kind of contribute. They think that may contribute to the BV at times, because women have natural, normal, healthy bacteria in their vaginas, and it's acidic to a point where it kills off any bad bacteria. But when you douche too much, that can kind of wash out the good stuff. That way, when the bad gets up in there, there's nothing good, none of the good ones are in there to attack it. So the bad stuff just gets up in there, have a party. Then you have this nasty, thick, white to gray discharge and this funky, fishy odor. So the doctors will tell you don't douche. And if you do, keep it to a minimum. Now with trichomonas, that's an STD. You have a thick yellow to green discharge and a foul, fishy odor. Both of those, you need antibiotics to clear them up. There's no way around it. If you don't go to the doctor and get treated for them, you won't get rid of it. And you have to go home and tell your partner that you have it, because they need to be treated too, or else you're just going to keep passing it back and forth. And yeast infections can be treated over the counter. If you use the monostat, the 3-day monostat things, if that works for you, that's fine. I would suggest, if you know that's what you have, just come see your doctor real quick and get the 1-dose diflucan, because I've seen in some patients that monostat actually, some patients it works for them, but some it makes them worse, because you got to use it over the course of 3 days, and you're actually putting something up in your vagina, and that stuff can make you sore. Now if you're already itching and burning, why you want to be sore on top of that? And urinary tract infection. You can have a bad odor to your urine, and that might indicate that you got something going on in your urinary tract. You can get things over the counter for yeast infections and urinary tract infections. Now, for the urinary tract infections, there's nothing over the counter that will cure it. There are things that you can take to help you maintain for pain management until you can get to a doctor. There's this wonderful pill that you can get at the pharmacy called Cystex. That's really good for pain management, and it has a small amount of an antibacterial agent in it to hold you off until you can get to your doctor to get an antibiotic. Also, Azo makes the yeast pills that you can take, and the cranberry tablets for good urinary health. Now, neither one of those cure anything. They lessen your chances, or at least lessen the chances of it being severe when you have one. So funky vaginas don't always mean that you haven't washed. I think some women try to cover up odors instead of going to find out why they're having the odors that they have. Because sometimes there may be an underlying issue where you need some medication to fix that. Babies in your menstrual cycle pass through a different opening than urine. So you have two openings down there, okay? I've never even really thought of it. I don't think I've ever not known that I had. I mean, as long as I have been aware of my body, I knew that there were two openings down there. You know, besides, you know, your anus. So that really gives us three in that general area. They're being grown women and they got children that are almost grown, and they've had a lot of kids, like 4 and 5 apiece, and they didn't realize that they have two openings. But then I don't know why it shocked me, because actually the sister of one of those, I was talking to her one day about something. I don't know what it was. One of my sisters had a baby, and I think she was around or something. But anyway, because I hadn't seen her in a long time. But I remember her saying something. Oh, my camera moving. I remember her saying something about peeing from her clit. You don't pee from your clit. But she obviously thought that's where it comes from. So people, women, it's okay. Let me tell you, it's okay to take a mirror and get down there and look and investigate and see what's going on. I have patients that come in sometimes and they're trying to describe what's going on to me, like they might feel something down there, and it's something that they feel when they're white, when they're cleaning themselves, but they haven't actually looked to see what it might be. It may be something normal, and you haven't even looked to check it out. It's okay to take a mirror and look at yourself. It really is. I mean, if you feel something that's way out of the norm, if you have a husband that you're sleeping with, and he ain't too good to get down there and look either and see what's going on, you can ask him, hey baby, come check this out, something ain't right, look at this and tell me what it is. If he's been looking at your stuff, which if he's your husband, he probably has, he knows what's normal too. So it's okay. One of the doctors was telling me about a young patient that she had a few weeks ago, and she came in, she was about 17 or 18, and she obviously wasn't having sex, and I'll tell you why in a minute. Because she came in complaining about a bump that she had in her vaginal area. The doctor said she was down there and she was looking and she didn't see anything abnormal, and she finally just told the patient, she said, look, point to the area where the bump is. She said, it's right there, it's big, you don't see it? The doctor told her, point to it. I don't see anything abnormal, honey, point to it. She pointed to her clit. So she obviously didn't realize, she's obviously not having sex, because if she was, she would know that that's normal. So she obviously doesn't know anything about the function. I have a book, it's called Are We Having Fun Yet? I think every young lady from the age of 15 up should have that book, because no 17, 18-year-old should be coming to the doctor not realizing that their clit is not a normal part of their body. But anyway, I got a little bit off because the subject of this video was funky vaginas, but I had to touch on that a little bit. I really can't let you guys off the hook, because I did my clinical rotation in a urology clinic, and I ran across some guys whose penises and testicles were not all that fresh. They were just as foul and as fishy smelling as some of the women I come across in gynecology. So y'all got stuff y'all need to work out too. Maybe somebody could come up with a penis and testicle douche. That's something to think about. If you're just an overall generally nasty person and you're not bathing, you're wrong for that, and you do need to take a bath.